An emergency room physician will probably request many tests if you exhibit signs or symptoms of the acute coronary syndrome. While your doctor is interviewing you about your symptoms or medical history, several tests might be performed. Tests comprise electrocardiogram, ECG. Your heart's electrical activity is measured by electrodes placed on your skin. A shortage of oxygen can cause your heart to function improperly if you have abnormal or irregular impulses. Electrical signal patterns can sometimes indicate where an obstruction is generally located. The test could be run more than once. A blood test. If heart tissue has been harmed due to cell death, certain enzymes may be seen in the blood. A cardiac attack is predicted by a good result. A primary diagnosis of the acute coronary syndrome is made using the results of these two tests as well as your signs and symptoms. Using the data, your doctor can decide whether a heart attack or unstable angina should be the diagnosis for your symptoms. Other tests might be carried out to find out more about your disease, eliminate potential causes of your symptoms, or assist your doctor in determining the best course of action for you. Cardiovascular imaging. In this process, your heart's blood vessels are visible via X-ray imaging. To reach the arteries in your heart, a long, thin tube, catheter, is inserted via an artery, typically in your arm or groin. Through the tube, a dye is injected into your arteries. The movement of the dye through your arteries is seen on a series of X-rays, which also indicate any obstructions or constrictions. Treatments may also employ the catheter. Echocardiogram. Echocardiography creates a real-time image of your heart by using sound waves that are directed to it through wand-like equipment. Whether the heart is pumping properly can be ascertained with the aid of echocardiography. Imaging of myocardial perfusion. Using this test, you may determine how well your heart muscle receives blood. You receive a tiny, secure dose of radioactive material by injection. Images of the substance's journey through your heart are captured by a specialized camera. They demonstrate to your doctor where and how much blood is going via the heart muscles. Angiogram using computer tomography, CT. A CT angiography uses sophisticated X-ray technology to provide several images of your heart that are cross-sectional 2D slices. These scans can identify coronary arteries that are obstructed or constricted. Stress test. A stress test demonstrates how well your heart functions during physical activity. Instead of exercising, you might occasionally be prescribed a drug to raise your heart rate. Only when there are no symptoms of acute coronary syndrome or another potentially fatal cardiac problem. When you are at rest is this test performed. An ECG echocardiography or myocardial perfusion imaging may be utilized during the stress test to assess how well your heart is functioning. Treatment. The following are the primary targets of treatment for the acute coronary syndrome. Relieve suffering and anxiety, increase in blood flow immediately and as effectively as you can. Restore heart function. The long-term therapy objectives include managing risk factors, reducing the chance of a heart attack, and improving total heart function. To achieve these ends, a combination of medications and surgical techniques may be used. Medications. The following medicines may be used for urgent or continuous treatment, or both, depending on your diagnosis. Blood clots that are obstructing arteries can be removed with the aid of thrombolytics, clot busters. By momentarily expanding blood arteries, nitroglycerin increases blood flow. Aspirin, clopidogrel, Plavix, prasugrel, Efient, and other antiplatelet medications work to stop blood clots from developing. Beta blockers aid in cardiac muscle relaxation and heart rate regulation. They reduce blood pressure and lessen the strain on your heart. Examples include nadolol and metoprolol, Lopressor, Toprol-XL, Corguard. The heart can function more effectively thanks to angiotensin-converting enzyme, ACE, inhibitors, which enlarge blood arteries and enhance blood flow. Benazepril, Litensin, Lisinopril, Prinavil, Zestril, and other medications are among them. Blood pressure is managed by angiotensin receptor blockers, ARBs, which include losartan, Cozar, irbesartan, Avapro, and several more. Statins may solidify plaque deposits, reducing the likelihood of rupture, and they reduce the quantity of cholesterol that is circulating through the blood. Several medications are statins, such as atorvastatin, Lipitor, simvastatin, Zocor, Flolapid, and others. Surgery and other procedures. To re-establish blood flow to your cardiac muscles, Your doctor might suggest one of the following procedures: stenting and angioplasties. A long, thin tube, catheter, is inserted by your doctor into the section of your artery that is blocked or congested during this treatment. To reach the constricted space, a wire with a deflated balloon is inserted through the catheter. When the balloon is inflated, the compressed plaque deposits against the artery walls help to open the artery. To assist maintain the artery open, a mesh tube, stent, is typically left in the artery. Surgery to bypass the heart. With this treatment, a surgeon makes a new blood vessel, transplant, that circumvents, bypasses, a blocked coronary artery by taking a segment of blood vessels from another section of your.
For any questions, leave a comment below and don't forget to subscribe.